Your doctor handed you a prescription. You filled it without a second thought. You have been taking it for months, maybe years, and you feel fine. But here's what nobody told you. That pill, the one sitting on your bathroom counter right now, may be quietly dismantling the exact system that keeps you from hitting the floor. Falls are the #1 cause of injury death in adults over 65. Not heart attacks, not strokes, falls. And the most dangerous trigger is hiding inside your medicine cabinet. Today, we are going to name 4 specific medications, explain exactly what each one does to your balance system, and give you the precise questions to bring to your doctor before your next prescription refill. Stay with us through all 4, because the 4th one surprises almost everyone. Most people picture balance as a simple thing. You either have it or you don't. That is completely wrong. Your body uses 3 separate systems simultaneously to keep you upright. Your inner ear detects motion and tilt. Your eyes track your horizon line. Your muscles and joints send position signals up your spinal cord to your brain 100 times per second. All 3 systems must agree within milliseconds. When they do, you stand. Here is what nobody tells you about aging. After 60, your brain's ability to merge those 3 signals together naturally slows down by about 25%. That slowdown is manageable. Your body has backup systems. But here is the dangerous part. Certain medications don't just slow that signal processing. They actively block it. They interfere with neurotransmitters, drop your blood pressure in the wrong moment, or sedate the very reflexes that catch you when you start to tip. You are not clumsy. You are being chemically disadvantaged. And that distinction matters more than you know. Before we name the first pill, understand this. None of what follows means you should stop taking your medication. What it means is that you deserve to have an informed conversation. Because right now, the odds are high that your doctor has never raised this subject with you. Let's change that. The first class of medications is one of the most commonly prescribed in America. Blood pressure medications, ACE inhibitors, beta blockers, calcium channel blockers, and diuretics. Tens of millions of seniors take at least one of these every single day. They save lives. This is not in question. But they carry a specific fall risk that most doctors simply don't have time to explain during a 12-minute appointment. When you stand up from a chair or a bed, your body normally triggers an instant compensatory response. Your heart rate bumps up. Your blood vessels briefly constrict. Blood rushes upward to feed your brain. That entire process takes about 1 to 3 seconds. Blood pressure medications can blunt that response. The result is called orthostatic hypotension, a sudden drop in blood pressure the moment you rise. For 2 to 5 seconds, your brain is receiving less oxygen than it needs to process your surroundings. You feel a rush of lightheadedness. Your vision dims slightly at the edges. And in those seconds, your balance system is operating blind. Studies show that orthostatic hypotension increases fall risk by 67%. The fix is not always a dosage change. Sometimes it is simply learning the right way to rise. But you cannot use a fix you don't know exists. Coming up next, the sleep medication that millions of seniors take weekly, and the hidden morning effect that persists long after they feel wide awake. The second and third categories belong together because they work through the same mechanism. Sleep aids, including both prescription options like Ambien and Lunesta, and over-the-counter choices like Benadryl, along with older antihistamines like diphenhydramine, all share one critical property. They are anticholinergic. That word sounds technical. What it means is this: they block acetylcholine, a neurotransmitter your brain uses for sharp, coordinated movement and rapid reflex response. Take one at 10 p.m., feel groggy when you wake at 7 a.m., feel fine by 9 a.m. That is the experience for most seniors. But here's the counterintuitive truth that clinical research has confirmed repeatedly. Anticholinergic effects on muscle coordination and balance can persist for 12 to 16 hours after you feel subjectively alert. Your mind clears before your muscles do. You feel awake. You feel steady. But your reflex catch time, the automatic grab your body makes when you begin to fall, may still be delayed by 30 to 50%. This is why the bathroom in the early morning hours is one of the most dangerous rooms in the home for seniors on sleep aids. You feel completely fine walking to the bathroom at 6 a.m. And then something shifts, and your body responds half a second too late. Diphenhydramine, in particular, has received so much attention in the geriatric medicine community that many physicians are now recommending their senior patients avoid it entirely. If you are taking any sleep aid regularly, this conversation with your doctor is not optional. It is urgent. The fourth medication is coming, and it is the one that surprises people the most, because it is prescribed for something that has nothing to do with balance. Here's the statement most people find genuinely shocking. Selective serotonin reuptake inhibitors, SSRIs, the most widely prescribed antidepressants in the world, increase fall risk in seniors by up to 70% in some studies. Not 10%, not 20%, 70%. 70%. SSRIs include medications like Zoloft, Prozac, Lexapro, and Paxil. They are prescribed for depression, anxiety, sleep disturbances, and even chronic pain. They are considered among the safest medications in modern medicine, and yet their effect on the motor system in adults over 60 is profound. Here's why. Serotonin does not only regulate mood, it plays a direct role in motor control, postural regulation, and the processing speed of spinal reflexes. When you alter serotonin levels, even in positive therapeutic ways, you simultaneously alter how your nervous system manages the rapid micro-corrections your legs and trunk make every single second you're standing. Some seniors experience this as a subtle unsteadiness. Others describe it as feeling like the ground shifts slightly when they turn their head too fast. Many never connect the sensation to their antidepressant at all, because they feel emotionally better on the medication, so they assume everything is fine. Tricyclic antidepressants carry an even higher risk, partly because they also have anticholinergic properties. The fall risk compounds. Here is what is important. There are options, a different medication, a different dose, a different time of day, but your doctor can only help you navigate those options if you raise the question. And before we tell you exactly how to have that conversation, let's close the loop on everything we've covered. You now know the 4 categories: blood pressure medications that drop your pressure when you stand, sleep aids and antihistamines that impair your reflexes long after you feel awake, and antidepressants that alter the very architecture of your motor control system. Knowledge only has value when it changes behavior. So here is exactly what you do next. Pull out every medication you take, prescription, and over-the-counter. Write down the name of each one, then call your doctor's office, or send a patient portal message before your next visit. Ask specifically, can any of my current medications increase my fall risk? That one sentence is enough. You do not need to diagnose yourself. You do not need to diagnose yourself. You do not need to arrive with a research paper. That question alone will signal to your physician that this needs to be addressed. If you take more than 5 medications, which describes roughly 40% of adults over 65, ask specifically about a medication review. Many health systems now offer geriatric pharmacist consultations for exactly this reason. Beyond medication conversations, 2 additional steps make an immediate difference. Rise slowly and deliberately, every single time, from bed, from a chair, from the toilet. Give your body 3 full seconds before you take your first step. This alone can reduce orthostatic fall events significantly, and if you are on any sleep medication, consider a nightlight path, from your bedroom to your bathroom, a non-negotiable. These are not complicated interventions. They are free. They require no prescription, and they can prevent the kind of fall that changes everything. The one that leads to a hospital stay, a surgery, or months of recovery that none of us want to imagine. Falls are not inevitable. They are not just part of getting older. They are events with causes, and many of those causes are preventable. Your medication cabinet is a place to start. Your next doctor's appointment is a window to act. If this video helped you see something you hadn't seen before, subscribe to Steady Steps right now. Every week, we bring you the fall prevention information that your doctor genuinely doesn't have time to deliver in a 12-minute appointment. Share this video with someone you love who is over 60 and taking any of the medications we discussed, because the conversation you start today might be the one that protects them from a fall they never saw coming. We'll see you in the next video. Stay steady.